I am Senator Elijah Reichlin-Melnick, and it is a pleasure to be here to support this very needed legislation. We're here to address a major problem with a very simple solution. For far too long in the state of New York, there have been two different systems, two different schools of thought, a structure of separate but equal, so to speak, treatments that create a stigma around mental health, and it has very real impacts on the way that mental health care is administered in our state. Our bill, S.3995 and A.5238, will ensure parity between mental and physical health in the New York State Constitution, guaranteeing New Yorkers that mental health care is health care. For years, cuts have been made to mental health services to help balance the budget in New York. This year, Governor Cuomo proposed closing down the Rockland Children's Psychiatric Center as a cost savings measure. This would have meant that the children and families of the lower Hudson Valley that need life-saving mental health treatment would have had to travel hours away from their home to a facility in the Bronx or out to Utica. Thankfully, with the support of my colleagues and thousands of activists around Rockland County and the Hudson Valley, the 2021 and 22 New York State budget rejected those cuts, and Rockland Children's Psychiatric Center remained open to serve the most vulnerable residents of our communities. However, while this facility was kept open, the number of beds for inpatient services at other facilities across New York faced cuts. In the middle of a pandemic, when extended isolation and fear have created a mental health crisis, we have to change our paradigm. It's no longer acceptable to consider mental health as secondary to physical health. No longer can we let mental health issues be dismissed as personal failures or as temporary feelings that a person should overcome on their own. We need to make sure that New Yorkers know that mental health care is health care, that there is nothing wrong with needing help, that we, as the leaders of the state of New York, stand with mental health organizations and mental health care providers. Our bill will make sure that it is part of the defining laws of New York, part of our Constitution, a constitutional right of all New Yorkers, that their health care is not limited just to their physical health, but that their mental well-being is just as important. I'm proud to partner with Assemblywoman Dee Dee Barrett, who has been leading on these issues for years, to introduce this legislation, and I look forward to the day when we can all say that mental health care is health care. And we know that the Constitution of the state of New York will back us up.